This week in Jamaica Now, 8 cases and counting.
There will probably be more imported cases.
Coronavirus hits Jamaica. Local spread has begun. The father of patient 0 is among those infected. Why a Clarendon community is especially anxious amid the coronavirus. Schools closed, carnival pushed back, public gatherings are being discouraged. Government encouraging employers to allow their employees to work from home. And 5 injured in major explosion at New Kingston restaurant.
You just see a boom fly, next girl fly, head up on fire, man up on fire, foot up on fire, film foot up on fire. Scary me, I tell you.
I'm Damian Mitchell and this is Jamaica Now. Jamaica has started to record a local spread of the coronavirus COVID-19. So far, 8 cases have been confirmed in this country. One of them involves the father of the first patient tested positive for the virus. Another was in close contact with her. The first patient is a Jamaican living in the United Kingdom who came to Jamaica on March 4 for a funeral. The second patient was a United States Embassy employee who returned to Jamaica via Miami, also from the United Kingdom. In a statement released Friday morning, the Health Ministry said the 4 other new cases involved people with recent travel history. Earlier at a special Gleaner Editors Forum, Chief Medical Officer Dr. Jacqueline Bissesa-McKenzie said more imported cases were expected.
Once it is that persons start transmitting from imported cases to now cases that are in the population, it means that there is an opportunity for wider spread. So the focus of the population has to really be how do they prevent transmission.
And schools have been ordered closed initially for 14 days. In making the announcement, the Prime Minister Andrew Holness said there will be a review after 10 days to decide whether there should be an extension. The University of the West Indies, Mona, will reopen after Easter, and several other tertiary institutions like the University of Technology Jamaica have been closed initially for 14 days. In the meantime, Mr. Holness is discouraging public gatherings. The annual Boys and Girls Athletics Championships has been called off this year, and Jamaica Carnival has been pushed back until October 2020, with the road parade set for October 25. In the meantime, the Permanent Secretary in the Health Ministry, Dunstan Bryan, says key attention is being placed on ensuring that business activities continue. Employers are being encouraged to allow employees to work from home and give special consideration to those who may have been quarantined.
That business continuity must now examine what are the requirements that the business needs to ensure that they are able to sustain their infrastructure. We also want organizations to pay keen attention to leave entitlement, especially when it comes on to persons as we go through the different phases of the epidemic. The leave entitlement for quarantine versus leave entitlement for sick leave.
And Jamaica's Finance Minister, Dr. Nigel Clark, says the local retail and distribution trade has assured that it has up to 3 months' supply of basic food and other essentials in storage. The Bank of Jamaica Governor Richard Biles also says there are plans in place to ensure normal functioning of the financial system and financial markets.
Jamaica's banking system is sound, strong, and has adequate liquidity to ensure continued economic activity during this period.
According to him, there is collaboration with the commercial banks to ensure the banking systems continue, and there is in excess of $3.5 billion in foreign reserves, which will be adequate. However, there has been a rush on supermarkets and pharmacies for food, disinfectant, sanitizing agents, and other items. Both the Finance Minister and the Prime Minister have been begging the public to remain calm.
Greatest weapon in the fight against the spread of this disease is accurate information. That is the greatest weapon. And therefore, the government is establishing itself as the source of accurate information.
Meanwhile, the Chief Medical Officer, Dr. Jacqueline Bissesa-McKenzie, says it will take about 8 weeks for the COVID-19 to peak in Jamaica before a decline in the number of cases begin. This is based on modeling projections of 400 critical care cases over a 1-year period with a peak week of 11 additional persons. In the meantime, she says the government is working to expedite the delivery of vital hospital equipment. Some nurses, including those working at the Mandeville Regional Hospital, have complained that they do not have sufficient protective gear. Frontline staff in immigration halls have also complained. But the CEO of the Passport, Immigration and Citizenship Agency says adequate provisions have been made.
Well, all our frontline staff right now have been issued with gloves, masks, hand sanitizer, Lysol wipes, and we provided them with all the equipment. Because we took some lessons learned from the time when there was the Ebola scare. So now we just continue on those same protocols. We are now also looking at how else we can improve the protection of our officers.
In Clarendon, there was panic in the community of Goshen in Moko as news circulated that the father of patient 0 was suspected to have the coronavirus. The man operates a shop in the community and also hosted a bingo party, which many attended. In the meantime, the councillor for the Moko division, Romaine Morris, is raising concern that only 25% of the community has access to potable water. He says there is an urgent need for additional funding to buy water. The mayor of Mapen, Winston Murad, says the health authorities will be on top of the situation. In other news, a major investigation is now underway into an explosion and fire at the Tower restaurant in New Kingston this week. It happened minutes before 10 o'clock as workers were preparing lunch.
You just see a boom fly, next girl fly, head up on fire, man up on fire, foot up on fire, film foot up on fire. Scary me, I tell you.
And one of the injured workers says it appears that there was neglect because there was an apparent gas leak days before the explosion that was not speedily addressed. Be warned, however, that the video you are about to see could be disturbing.
Monday night now, I see the man take up tools, say I go fix gas. Tuesday morning before the incident or the accident, about 10 minutes before that, the man take up tool again, say I go fix gas. But see how me look at me burn up, you know. Me burn up, look at me now. I am a bartender by professional. I went to the art trust. Who is going to hire me looking like this now? How long me have to sit down before my face come back before me can get to work?
And that's it for this edition of Jamaica Now, your weekly review of the big news stories. Send us your comments at onlinefeedback@gleanerjm.com. You may tune in to Power 106 FM for regular updates. Follow us on Instagram and Twitter at Jamaica Gleaner and on Facebook at Gleaner Jamaica. I'm Damian Mitchell, and before we go, how vendors in the Montego Bay Craft Market are responding to the COVID-19.
Coronavirus go come and go and one next bother one and Carolina they go come again. You understand? So it don't make no sense. We just need to know say we will keep it surrounded clean and tidy.
What is for you, you will get. And why you don't want, you will not get. Because can't full dog nyam dirty pudding. And at the same time, if your resistance is strong, you will resist from it. Just protect yourself. Me don't need no hand sanitizer. God will sanitize me hand. Because me put me trust in a gun. I think it's cold sometime you don't have.
I think that each person in our craft market have a personal responsibility to decide to themselves so their individual space and their neighbors really clean. So if them seats are right now, the place is shut down, we're not in a total agreement.
Sanitize myself. Wash my hand properly. I don't talk in people's face and I don't want nobody talking my face. I don't shake hand. Not because of coronavirus. From ever since I don't like shake people hand. I don't know what to do with your hands.
What do you think about it? You think it's a good idea to lock down for a while, clean up and come again?
Yes. Well, if that is the best idea if you done, well that have you done. You understand? Yes. Because we don't have no cure for it and we don't have no way over it. Besides, now we try to take care of what we can take care of.
Sometimes when we are run from the thing at that time we reach here, we don't expect it. When we know say God is with for me, I don't know about nobody. And I know He is with me and He is my sanitizer and He answer prayer. I know He will heal me. I mean, I'm going to put on nothing and look how I'm going to live so to me 110. Right.